Please contact us on our email for more information and access to the link. We do have a feedback form, which we would really appreciate you completing at the end of the session, as this will help us understand how we can improve events going forward and what health events you would like us to offer in the future. So on to the event itself. We have a selection of specialists who will take us through the process for memory loss and concerns, and what to expect when you first call the surgery for that initial appointment. On to what happens next after a referral is made to the memory assessment team, and then looking at what support is available for both the person with the diagnosis, their carers, and their families. We'll also look into what we can all do to delay getting dementia and memory loss by making lifestyle changes. Just to say, please be mindful that the timings for presentations are approximate, and we do recommend, if you wish to come and go throughout the event, that you come back 10 or 15 minutes before the presentation that you wish to hear to avoid disappointment. So first up, we have Penny. Penny is a GP assistant. She's based at Locksville Surgery, and she's going to talk us through memory and dementia awareness. Thanks, Penny. Penny, you're on mute.
Thanks, Jackie. Good evening, everyone. So, as Jackie quite rightly said, my name's Penny. I'm one of the GPAs for the Ivor Valley South PCN. I work mainly out of Larksfield Surgery. And what I wanted to bring to you all this evening was just a little bit of information about the signs and symptoms of dementia, what things to look out for, and how to seek some support and help from your surgery with those initial concerns. So the process I'll be talking you through this evening is what is offered in the surgeries that we cover. So Shefford, Lower Stondon, Larksfield and Owsley. If there's anyone sort of out of area or have got relatives in other localities, their kind of system might be a little bit different, but this is the kind of thing that we can offer and we can help with for our patients in the area. So common first signs of dementia. You might start, if you notice you're starting to experience difficulty concentrating, any sort of memory loss, you're finding daily tasks just that little bit more difficult, things are tripping you up, you're getting a little bit more confused, something simple like finding correct change or knowing the order to do something in can all be a sign that there's something going on for you in terms of your memory. If you're struggling to follow conversations or tripping over words, not being able to find the right word, that's also something that could be an indicator that there is some memory changes going on there. If you find yourself confused about the time or the place that you're in, is it morning, is it afternoon, where, you know, how the order of your day is going, and changes in your mood, if you find you're becoming agitated, frustrated, all signs that there could be something cognitively happening. But if you're experiencing those symptoms, it doesn't instantly mean the start of dementia. So many things can affect our memory and our cognitive function. Stress, poor sleep, anxiety, depression, and what we know as brain fog that can be caused by so many chronic conditions, medications, menopause, all those sorts of things. So experiencing these symptoms isn't a prescriptive method of diagnosis. So if you have been experiencing any symptoms, your family members have, or you have any concerns about your memory, you can request an appointment from your surgery. In our area, these appointments are conducted with the GPA team. And what we'll do is we'll go through any questions or concerns that you might have, it's a great opportunity for you to bring your issues to the table, and we can create a holistic picture of where you are in terms of your physical and cognitive health. There will be a basic memory assessment, might be referred to as a 6CIT, MMSE or GP cog test. They are all different sort of technical terms that are used for various memory assessment tools. They usually involve the individual answering some simple questions. They might seem a little bit silly at the time, but they give a really good picture of where you are cognitively. And you'll undergo a blood test and a health check. So as we say, there's 101 things that could be affecting your memory, not just the start of dementia. So we'll do a full panel of bloods, make sure we check everything, hormone, vitamin levels, liver, kidneys, full blood count, a full little MOT to make sure you are healthy, and we can rule out any physiological factors that might be influencing these memory changes. We'll also talk about your day-to-day activities and find out exactly where these difficulties are cropping up for you. So creating a really holistic picture and trying to find the best places to signpost you for help. It always helps to prepare a little bit for these appointments. They are quite in depth and they do take, and there is a lot of information to cover. So if you can, keep a note of any concerns you're having as they crop up and bring these with you to the appointment, because it can be quite difficult to recall everything when we're in that situation. And by all means, bring someone with you for support. Someone you live with, a spouse, a relative, a friend, someone you trust, who can help, who also sees you quite regularly, as they can help us create that picture and be a support for you. Once you've been through that appointment, dependent on your memory scores, the issues we've discussed, and any results from your blood tests, you may need a GP appointment. If so, we will arrange that for you and that will be communicated to you fairly quickly. We may refer you straight off to the memory clinic, and then they will be in touch and they will take over. They are a specialist team in the diagnosis of dementia and cognitive conditions, and they are here to speak with us this evening. So, without further ado, I'd like to hand back to Jackie for our next speaker.
That's great. Thank you, Penny. And it might just be worth adding on the feedback form, and we'll give you the link to that halfway through the presentations and also at the end. You can, if you want to, ask for help making an appointment with your GP surgery to have that assessment that Penny's talking about. So if you put your name and obviously your contact details, helpful to know which surgery you're with as well, and we can give you a lift as well making that appointment. Lovely. So that leads on perfectly to the memory assessment service, and we've got Dr. Aniba Anwar and also Dr. Jeanette Fuller here. A warm welcome.
Hi, good evening, Jackie, and thank you. You can hear me? Okay.
Yep, that's perfect.
Okay, and my colleague, Dr. Janet Fuller, is also here with us.
Hi, everybody. Nice to, well, I can't see you, but nice to meet you, sort of.
Yeah. So I will introduce myself first. So I'm Aniba Anwar. I'm one of the consultant old age psychiatrists and lead memory services in Bedfordshire and Luton area. And Dr. Fuller, if you would like to introduce yourself.
Of course, yeah. Hi, everybody. My name's Jeanette. I'm a clinical psychologist, and I also work alongside Aniba across the Luton and Bedfordshire Memory Assessment Service.
So today we thought we could cover two main areas within the time frame which is given to us. One is, what is dementia? What do you classify as dementia? And the other area which we would like to cover today is about the referral and the assessment pathway. So I will be briefly talking about dementia, and Dr. Fuller will talk a little bit more about our referral pathway. We also have videos which were done by our fantastic memory service team, and obviously these links will be shared by the team later on as well. So 5 really important messages I want you to take home today is that dementia is not part of normal aging, and it is caused by a disease of the brain, where the most common cause is Alzheimer's disease. It is not just about losing your memory, but it can also impact your thinking, communication, and it has impact on your day-to-day life and ability to do the task. It is certainly possible to live well with it once you have got a support in place and ability to find the right support that you need. And I'm sure later on talks will cover that in a bit more detail. And there is certainly more to a person than the dementia. Next slide. Thank you. So one of the most common questions I get asked is, what is a difference between dementia and Alzheimer's disease? So dementia itself, it is an umbrella term, which is used to describe symptoms like memory loss, confusion, and personality change that is having impact on your day-to-day life. Whereas the causes of dementia could be various, and the most common disease is Alzheimer's disease that leads to symptoms that really come up as dementia. There are other causes as well, like someone, if they have a stroke or they have problem with certain part of the brain, like dementia with Lewy body, frontotemporal, and some people with Parkinson's disease also develop problems and leading to dementia. And there are certain other causes as well. But it's important to understand the difference between the terminology that is used. Thank you. Next slide. So Penny has already covered about what you could watch for, look for signs and symptoms when you're experiencing problems with memory, or it may not be just a memory, but there are other things as well, such as problems with the language, ability to find the right word or to name objects. Sometimes people may also experience some behavior change or personality change. They may experience hallucinations where they see things which are not there, or there may be some problems with images and spatial awareness, not able to read, and misplacing things in the home. Or sometimes it also impacts your confidence. If you're thinking, I'm having difficulty with communicating with other people, or not able to find the right word, people may withdrawn from their work or social activities. There could be difficulty in planning or problem solving as well. So if, for example, planning for Christmas meal or a party, you have various steps to look for, that which people to invite, how to do shopping, what to plan for the day. And it is something you may have been able to do that in the past, but now finding it difficult. So if you experience all these different signs and symptoms, it may be one or two, or maybe multiple signs and symptoms, then it's important to seek help. Thank you. Next. Another important point I want you to take home today is that not all the memory issues are due to the dementia. There are various other problems, and I'm sure, I think Penny has also mentioned that in her slides, is about other conditions that may mimic dementia. But these are the conditions which are treatable, which are reversible, and it's important to address that and identify what are those problems that can be treated in a timely manner to prevent that memory getting worse. So one of the common examples is that people may have heard about the thyroid issues. If you are undertreated or have a thyroid problem or certain vitamin deficiencies, that can also cause memory problems. But similarly, sometimes you are on various medication for your physical health. And over the years, no one has reviewed that some of those medication may not be suitable, or you need to reduce the dose, and it may be causing a bit more pressure on your brain to work hard and leading to memory symptoms. So important that those medications could be reviewed by your primary care GP. And sometimes excessive alcohol, again, is another factor in some cases, need to be addressed. Depression can also impact person's attention and concentration, leading to no ability to retain information and leading to sign symptoms similar to dementia. Brain fog that people experience, like within menopause, as well, important factor to address. And it's important to also think about vision and hearing, and if these things can be checked to see whether you can reduce those factors. Certain infections can also lead to the similar problems, and it's important that if there are any infections that can be treated, because people can get a little bit more confused after infection, and whether you allow that period or few weeks to see whether that would help to get back to your normal level. The next slide, yep. So there was a study done, and the scientists had identified some of the risks that could lead to increased risk of developing dementia. So as I said, it's not just a disease of an old age, or you experience symptoms when you're getting old, but there are certain factors in your midlife as well that you can try and address that can potentially reduce your risk of developing dementia at a later age. And 45% of these factors were identified in this study and was published in the last few years, and 2 other factors were added in 2024. So factors like if you have a cognitive reserve due to the education level, that is a little bit protective factor, because person may be able to mask symptoms a little bit more, but also it may be protective as well because you have high cognitive reserve. But also other factors which I mentioned before, but checking your cholesterol, checking for hearing loss, depression, increasing your physical activities, addressing any factors like smoking, high blood pressure, diabetes, alcohol, and all these areas you need to address. But later in life, social isolation, air pollution, and vision loss have been also associated with increasing the risk. And some of these factors are easy to address, some are quite difficult and obviously not in control. Genetics and increasing age is another, there are 2 other areas which increases the risk of someone getting a disease at later life. So now I will hand over to Dr. Fuller to talk about the referral process and assessment. Thank you.
Thank you. So just, I guess, following on from the previous speaker, the first thing we always would say was that you would go and speak to your GP and you'll do all of the things that have already been discussed. So the physical health checks, a brief test, and then if your GP doesn't think that there's any reversible cause that they can identify, that's when you would be likely referred onto the memory assessment service. Next slide, please. Thank you. So you come over to see us if you're in our area. So once we get the referral, we review it and we make sure that all the stuff that we need has been done, and then we accept the referral. And then what happens after that is that you'll get a telephone call from one of our clinical team who'll just ask some very basic questions around things that you've noticed and make sure that you're aware of the referral and that you're happy to have the assessment and you have a rough idea of what that involves. They would also speak to a family member if that's okay. So we seek consent, and then we'll have a chat with the family member as well. And then you'll be given a date and time for your memory assessment appointment. So on that first phone call, you'll know when you're going to get the appointment, which will follow up by letter. We'll just also remind you to bring any things you might need, so hearing aids, glasses, because we'll also do a bit more testing and we want to make sure that you get the chance to do your best. So we need you to be able to see and hear things properly. And we usually ask someone who knows you well to come to the assessment, because sometimes people can just see things that you might not be able to see or might have a slightly different view. So just it helps us to get a kind of really good idea of what's happening day to day. The assessments are quite long, so they're usually around about 90 minutes. Sometimes they can be a little bit shorter, sometimes they might be a bit longer, depending on how chatty everybody is, or how many things we might need to investigate. So you could be seen by any of our team, really. It could be a consultant psychiatrist like an Eva, or one of our other sort of doctors in training, one of our dementia nurse specialists, or eye psychologists like myself, or our assistant psychologists. Usually people come into the clinic because we like to have the environment where we can kind of have less distractions, and sort of have access to things that you might need, like the tests. But if people need to, we will go to people's houses, and we also visit care homes. The assessment's normally just what we call a conversation to start off with. So we'll just be talking to the person who's concerned about their memory, their family and their friends, to get as much information as we can about their memory and their other thinking skills, because as Aniba's mentioned, it's not always just memory. And we'll also be asking how things are going day to day. So are these problems causing issues in your ability to do your tasks? We ask some questionnaires to be filled in. So we'll ask your family member to do some questionnaires about things they might have noticed. And we will also ask you to complete a short pen and paper assessment. So you might do a very short one with the GP. We do a slightly more detailed one. If you come and see a psychologist in our under 65s pathway, you might get an even longer test. But these are to test different things. So attention, language, memory, and your visual skills. Somewhere around the time of the assessment, we're usually asking you to attend an appointment for a brain scan. So usually that's at your local hospital, but sometimes we might have to ask you to go to somewhere out of area if we think we need something a little bit more specialist. Quite often we have enough information at the initial assessment to be able to make a decision about a cause of the cognitive problems. But sometimes things just don't work out that way, and there might be some complexities, some different things we need to look at a little bit more. So sometimes we might ask you to have an OT assessment. So OT stands for occupational therapy. That's where we have an occupational therapist who'll come and see you at home, and they'll want to watch you do some of your day-to-day tasks, but in a very particular way, to see whether you're able to kind of follow these instructions in a particular way, or whether there's some difficulties there. And sometimes you might be asked to have a neuropsychological assessment, which is a really fancy way of saying a really more detailed cognitive test, so a test of your different skills. Again, ideally, that's normally in clinic, because we like to be able to make sure there's not lots of distractions that could get in the way of you doing well on the test. And those tests are a little bit longer. So we're normally around about an hour and a half, looking at all the different things your brain can do. So how well you can keep your focus on things, whether you can get the right words out for things and name items, whether you can process things visually and through your ears. Obviously, we talk a lot about memory. And we might test some of those complex thinking skills as well. So we do a lot of different tasks. They're things like puzzles, games, and questions. So it's not like an exam. It's very much sort of doing different things that you don't normally get to do to see what your brain can do in certain conditions. Then these tests we take away and we score them and make some sense of them. So we're always comparing people to data of the same age and background. So we're not expecting people to do at the age of 75 what they could do at 25, and we take into consideration people's education and their language that they speak and what culture they've come from. We then share those results with the whole team and this is another piece of the jigsaw puzzle to kind of make a decision. Then we call you back in to give you a feedback appointment to explain what the results mean and what the outcome is, and that could be with a psychologist, a nurse, or one of our doctors. The feedback is really focused on that cause that we've been talking about, because as we know, cognitive problems can have lots of causes. So sometimes it might be to give a diagnosis of dementia, but sometimes it's not a dementia, and there can be things like anxiety or low mood, physical health problems, sleep problems, things to do with drinking, loads and loads of different things. Every week I'm surprised by something new. So we'll talk you through those factors if we don't think it's dementia. Talk about changes you can make and ways to maybe kind of reverse and manage these problems, and also what other services could help you. If we are thinking that the problems are caused by dementia, that feedback session will focus on explaining that particular type of dementia and what that means, all the support that will be available right now, but also thinking about the future and what access you might need to things later. Sometimes we'll talk about medication. So for some types of dementia, for some people, there are medications that can be helpful, not to cure or reverse, but to sort of manage some of the symptoms. So we sometimes will talk about whether it's a suitable option to trial. And then we offer something called a moving forward session. So after diagnosis, there's a session a couple of weeks later where people have had a chance to think about the diagnosis, and come and ask some questions. If you haven't been prescribed a medication, you'll kind of be transferred back to the GP and other services in the community. If we prescribe a medication, we'll follow you up for around about 3 to 6 months afterwards. I think that's us.
Lovely. Thank you. Thank you both. And just to say, so the referral process will be going to your GP first, as Penny has described, and having that initial assessment at your GP surgery. And if need be, then the referral is then made on to the memory assessment service. Great, which leads us on beautifully to Claire Day, who's with us today. And Claire is from Dementia UK, and she's an Admiral nurse.
Hi everyone, good evening. Thank you for joining. Yeah, I'm here tonight just to give you a quick overview of a relatively new service in the central Bedfordshire area of a Admiral nurse. So I'm going to talk a little bit about Admiral nursing, what we do, how we might support people, and also how you might get in contact with us. So one of the first questions I get asked is always about why are we called Admiral Nursing? It's nothing to do with sailing or the seas. It's because the charity that support us as Admiral Nurses are actually part of Dementia UK, a national charity. This charity was founded by the family of a gentleman called Joseph Levy. Now, Joseph had a mad love about sailing. So he was affectionately known by his family and his friends as Admiral Joe. So that's how Admiral Nurses got our name. We started off as Admiral Nursing in London with 4 Admiral Nurses in the borough that his family lived. And as of today, we now have 455 Admiral Nurses across the UK. So still not enough for every area, but getting better. Every Admiral nurse, whatever area they work in, whatever setting they're based in, are specialist dementia nurses. So they're either registered mental health nurses or registered adult nurses. And as I said earlier, we're supported by Dementia UK, and they provide us a lot of training and clinical development. All Admiral nurses provide life-changing support as we hear back from our families and carers affected by all types of dementia. We allow people time, space, and the opportunity to talk about their emotional and psychological needs. Supporting people with dementia can be challenging, and we're here to help people with those challenges as best we can. So Admiral nurses, obviously, there are quite a few people in the population with dementia. Sadly, it is increasing, and therefore there can only be so much support an Admiral nurse can provide. So we work with the people that have got the most complex or challenging issues, or if their situation is particularly difficult. That may be the type of dementia that the person has or how they are responding to that type of dementia. Or it may be because of other things that are going on with situations in terms of their health or family dynamics. As an Admiral nurse, I complete a personalised assessment for each family, so the main carer of the person with dementia alongside the person with dementia themselves. We then agree a tailored support plan with them to address what areas of concern there are and what areas they're managing well and how we're going to promote those areas. We very much focus as looking at the family as a whole, so not just a focus or a spotlight on the person with dementia, much more about the family relationships and dynamics. And also, as we know, going to the right person for the right help with dementia is sometimes quite challenging. So a lot of work that I do in particular is helping people understand what support they need at what time and what services are right for them as and when they need it. This includes a lot of work with continuing healthcare teams, and also with palliative care teams. So examples of families that may want to contact the service or be referred to the service. I mentioned earlier where the situations where there's a high risk of carer breakdown, or if the carer and family member is really struggling and they just don't know what to do next. They don't know where to turn. They don't know who to ask. Maybe they've got no other support involved at the time, and they just need a bit of help and guidance on to how to access their support network. Where there are complex interactions with dementia and comorbidities, so that's where there's lots of different health impacts or other mental health problems that maybe make it more difficult for the family to manage, either with themselves or with the person with dementia. Maybe families just don't really understand what dementia is or what the disease is or how it's going to look into the future, how things might help, what things might not help situations. So it's an ongoing support for families to understand their caring role. If families are isolated, sometimes they might need help accessing the right support, and that might be geographically as well as practically. The Admiral nurses also provide specialist individual skills and training support for people, depending on what areas of need they have. That goes alongside other support that is available and training that is out there already. So it's very much an add-on to that. Admiral Nursing is very keen to help people and support them during and towards their end-of-life care. So looking at people's preferences as to where their care is held, whether they want to be at home, who they want involved, how they want that to look. So as with any other neurological condition, it's about recognising that and working with people with dementia and their families as to what they might want their end-of-life care to be. My support doesn't need to end after a person with dementia passes away. I can still continue to provide bereavement support for families and carers if they need it. Again, that's alongside existing support services. The Admiral Nurse Service sounds very grand, but it is only me as a lone Admiral nurse covering central Bedfordshire. Referrals can come to me through the single point of access with Bedfordshire Community Health Services, as you would with other specialist nurses. I don't need to have specific medical information or for a particular person to refer in to me. Families and carers can contact me directly through the single point of access contact details, which are on the screen. I will always give them a phone call to triage them, and it may be at that point I signpost them to existing services that can meet their needs, or they may then come onto my caseload and I will work with them until a point of discharge. Thank you very much.
Thank you, Claire. That's really informative. That's great. And I've also popped Claire's details there into the Q&A as well, and also put our details in as well. So any queries, you can come back to us at any point using our email address. So next we have Diane Cottrell, who's a PCN health coach, and she's going to talk to us about diet, lifestyle, and dementia.
Hello, everyone. Thanks for being here. I'm just going to do some headline stuff, not too much detail. So the basics of how we can try to prevent dementia or slow it down if we already have a diagnosis. So we'll look at the top line lifestyle changes that we can implement into our lives. So what do we know about our risk, how diet and lifestyle can affect that? So the research shows that poor diet can increase your risk. So not eating enough of the right foods or too much of the wrong foods. So not getting enough physical activity can also increase our risk. Not using our brain as much as we should. So we can also reduce our risk by eating more whole foods, foods that are not processed. We can eat more omega-rich foods, involve in physical activity. Regular physical activity doesn't have to be a big thing. Just walking daily is considered enough. And we can do some brain training. So that would involve doing an activity that challenges the brain. So even doing some sort of exercise that incorporates arms and legs would be part of your brain training, or puzzles, or singing, learning an instrument, or learning a new sport. So we'll look a little bit more at what can increase our risk. So following on the eating incorrectly, eating too many refined sugars, so cakes, biscuits, chocolates, pastries, ultra-processed foods that come with hidden sugars in them, these can increase our risk. And that leads on to a diet that's high in ultra-processed foods. And what I mean by that, if you have an apple, and that apple then becomes gummy bears, apple flavored gummy bears, that would make that apple now ultra processed. Or if you had a carrot that becomes a carrot cake, you have a carrot that is now an ultra processed food. So what I'm saying is try to eat more of the foods before they've been changed too much into something that is unrecognizable. Alcohol intake can also increase our risk. Poor hydration. This has been shown that can affect brain function even in people who do not have dementia. So it's even more important with people who have a diagnosis of dementia to have good hydration, because dehydration can lead to confusion, increased risk of falls and UTIs. And sometimes we just assume someone is just having dementia symptoms, but it can also be compounded by poor hydration. So a diet that's low in fiber will reduce our gut health. And the research shows that having a healthy gut leads to a healthy mind. And so we can reduce our risk there by keeping that gut-brain connection healthy by eating more fiber and reducing saturated fats. I heard the earlier speaker mention about cholesterol levels. So this is something we want to look at. So a diet that is high in fiber and low in saturated fats will also help us control our cholesterol levels. So what can you do? Simple things you can do. So following on from earlier, just eat less of the ultra processed foods, the cakes, the biscuits, the pastries. I know everyone is probably thinking Christmas is coming. What am I going to do? Christmas is only 2 days. It's Christmas Day and Boxing Day. So there's no need to eat pastries from the 1st of December and mince pies and start on the quality streets. So keep it less and protect yourself. So whole foods like porridge oats, beans, lentils, nuts and seeds, whole vegetables, unprocessed, not cooked too much. So a whole food, the less you do to it yourself, even if it's not ultra processed, but you don't want to cook it too much. So stir fries, salads, that sort of thing. Of course, reduce your alcohol intake. So there are options there where you can reduce it by trying low or zero options of alcohol. This is a good way to try and reduce the damage created by the toxins in alcohol. Again, hydration. So some research is showing that baseline hydration should be 2.4 liters of water or 4 pints of water a day or 10 glasses. And this is fluid. This is not just water. This is fluid. So that includes your teas and coffees. Of course, if you're drinking 2.4 liters of caffeinated drinks, that could be problematic. So try to mix it with low caffeine water and lightly flavored drinks, not too much sugar added to anything. So if you were to think of it in terms of how many cups of tea you have a day, if it's decaf or mostly decaf, it's 1 mug holds approximately 400 milliliters. So you can work at how many cups of tea if you don't like water. So fiber, eating whole foods like whole wheat, brown rice, whole wheat bread, that will help with reduction of risk. It will improve your gut health. It will improve your gut-brain communication. reducing fatty meat, so reduce red meat, include more white meat, oily fish. Well, these are omega rich. So 2 portions of oily fish is recommended. 2 portions of oily fish a week is a recommendation, and 1 portion of white to get the right amount of nutrition we need from white fish and oily fish. So what else can we do apart from diet? We can be more social. So again, research is showing that when we socialize and we interact with other people, it helps us protect our language. We have more language retention. If we're isolated and we're not talking to other people or hearing other people talk, we sometimes start to forget words and lose a little bit of our language. And one way that we can socialize is by joining an adult education or learning group. It doesn't have to be something technical. It could be arts and crafts, it could be knitting, but anything that's social that keeps you involved with other people and interacting with other people. So a lot of us look forward to our retirement and to do absolutely nothing when we retired at 60-ish. Some of us, like me, have to wait till we're 67, but when you retire, we don't want to just stop. We just want to carry on being active, eating well, but also socializing and continue to challenging our brains. So like I said, arts and crafts, playing a musical instrument, singing, even volunteering will get you out and help you protect your language and your mental well-being. Because again, we know that if you don't socialize, you can have low mood, and then you isolate even more and you lose more of that connection. So joining a walking group, so that will give you 2 things at once. You get your interaction and you get some physical activity. So engage with friends and family, or just whoever's available that is available for you to hang out with. So physical activity, like I said, doesn't have to be going to the gym, lifting weights and all that sort of thing. It's just gentle, regular exercise. The research again backs up that this sort of physical activity improves your memory and cognition and how you process information and how quickly you recall information. So physical activity is recommended. Some kind of cardio, so something that raises your heart rate a little bit, and some kind of resistance training. So resistance training could be as simple as, whilst you're watching TV, you've got a couple of bottles of water or tins of beans, and you do something like that, and then you march. If you are not mobile, as in you may be restricted to a chair, you can march in position. But for those of us who have any body parts that are movable, we should try and move them to help with get some more physical activity in our day. So just to summarize, to think about, so eat more plants, eat less sugar, reduce alcohol intake, move more, keep hydrated, and hang out with your friends. So even if someone is already has a diagnosis of dementia, we can still help by those of us who care for them by ensuring that their diet is as good as we can get it. I know there are issues where sometimes the person we're caring for doesn't want to eat or doesn't like something, but if in any way that we can get a little bit more fiber into them, so there are things where you can put fiber into water where it's soluble and it has no taste or texture. So that's a great way to add fiber to someone's diet who may have swallow issues and so on, or texture issues, or just has forgotten what they like and don't like. And also those of us who are caring for someone with dementia, we need to also care for ourselves. So all this is important for both parties. So and hydration is so important for everybody involved. So just remember that if you have a diagnosis, you can slow the progression or the speed of how it travels through, or you can try and avoid getting it altogether if that is possible, because a prevention is always better than a cure. Thank you.
Thank you, Diane, and some really great tips for all of us, really. As we say, prevention's much better than cure, and something we maybe can have control of as well, just making a few sort of lifestyle changes. That's brilliant. Thank you. Before we move on, just to give you the QR code. If you do plan to leave before the end, if you wouldn't mind just scanning the QR code and filling in our feedback form because your views are really important to us and it helps us deliver more events like this. And we'd like to hear from you what other events you would like us to deliver that are obviously health related. And also, if you would like help with an appointment at your GP with Penny or one of her colleagues about that first step, that first appointment, again, you can email us on our email address, or at the bottom of the feedback form, you can put your details on that as well. And we're more than happy to help you. So I'll just give you a couple of moments to scan the QR code and do the feedback form now if you wish. Alternatively, we will show you this slide at the end of the presentations and you can do it then if that's better. Okay, and next we have the Alzheimer's Society. We have Harriet Dew and Tamsin Try. Ladies, are
Hi,
you with
everyone.
us?
We're with you. Yes.
Hello.
We're here. Hi. Hi, everyone.
Hello, good evening. Yeah, I'm Tamsin from the Dementia Support Forum at Alzheimer's Society, and this is my colleague Harriet, and we work together on the Dementia Support Forum. So we're just going to give you a quick overview of what the Dementia Support Forum is and what we do. So just a quick rundown of what we're both going to talk about today. We're going to go over what is Dementia Support Forum. As a start, it's the screenshot that you can see on the screen. That's our homepage. We're going to discuss why peer support matters. And then Harriet will go over some member feedback and what our volunteers and staff do, our roles and responsibilities. And we'll see if there's time for any questions. So, what is Dementia Support Forum? So Dementia Support Forum is an online peer support community for anyone affected by dementia. Dementia Support Forum is free. It's available 24/7 and you can access it on any internet-enabled device. So your phone, tablet, computer, as long as you have an internet connection and a browser, you can go to our website to access the forum. And one of the selling points of the forum is that people can stay anonymous when using Dementia Support Forum, which means that even though it's a public forum, you can use a username like Knitting Nana or Crochet Cat to allow you to talk about sensitive issues and seek support more privately because nobody can link it to your real name. So on Dementia Support Forum, community members can ask questions. They can receive practical tips on how to deal with dementia. They can express themselves honestly, and they can give support and receive support from other members. And by joining the community, we hope that people can feel that they're not alone, be empowered and informed about dementia, and know that they have support available. And we have a short promotional video which we'd like to show.
Dementia Support Forum is Alzheimer's Society's helpful online community where anyone who is affected by dementia can receive valuable support. It's free to use and open day and night. Dementia can be a worrying and confusing condition, and we understand it can be hard to cope with the challenges it brings. But you are not alone. On Dementia Support Forum, you can ask for advice, read other people's stories, offload your concerns about dementia, and share helpful information.
I joined the Dementia Support Forum in the August of 2022 as my dear mum was on end-of-life care and I was at a particularly low ebb. The community of people that I found on the forum have been a great source of advice, of understanding and for knowledge. It really has helped me tremendously, and I would recommend it to anybody who may have a loved one or have been affected with dementia in any way.
I joined Dementia Support Forum in early 2018 At the time, I was looking for help for my mother, who I thought possibly might have dementia. The posters on the forum were brilliant, and within a couple of hours of that first post, I'd had some very sensible suggestions as to what I could do to support my mother. Over the next few years, as Mum's dementia developed, there was always someone there to listen and to give pointers as to what I could do to help her. I thoroughly recommend the forum. Nothing is off limits. You can talk about anything, and there will always be someone there to listen and to reply to you.
Dementia Support Forum is run by a small team of staff and supported by our brilliant volunteers. Our volunteers all have personal experience of caring for people with dementia. They help to welcome new members, point people towards useful resources, and provide ongoing support. You can begin by creating an account on the forum and posting a message to introduce yourself to other members. You may prefer to browse the community for a while and simply read what others have written before posting a message. Whether you join an existing discussion or ask your own question, Dementia Support Forum is an online community where members can provide you with vital support and guidance. Whatever you're going through, whether it's legal issues or practical everyday care, you're free to give as much or as little detail as you like and can stay anonymous if you wish. If you or someone you know is living with dementia, join Dementia Support Forum to speak to others that know exactly how you feel. To join Dementia Support Forum, visit forum.alzheimers.org.uk. If you would like to speak to someone about dementia, you can call our dementia support line on 0333 150 3456. To find out more about Alzheimer's Society, visit alzheimers.org.uk.
Thank you. And thank you for watching our promotional video, and thank you, Penny, for sharing it. So I'm just going to go over why peer support matters. So first, what is peer support? According to NHS England, peer support is when people with similar long-term conditions or health experiences come together to support each other, either on a one-to-one or a group basis. It is enabled through relationships that build mutual acceptance and understanding. And that's something that we find definitely comes across on the Dementia Support Forum. And here are just a couple of quotes from members about how they've found the peer support to be helpful. So firstly, this is a quote from a member whose mother passed away from Alzheimer's. And they said, "If you are reading this and you haven't joined, I urge you to. Even if you never post, you might read something that you can empathise with, and it will help you. If you do post, you will get responses. Not always ones that you expect, but certainly ones that will prompt thought and provide support." And the second quote I have is from one of our volunteer hosts, who's also a carer, who said, "What helped me most when I was at my lowest ebb was the kindness and good sense that I found as a member of this forum. Here you'll always find understanding, empathy and support to help you through the bleakest times." And I'll now pass over to my colleague Harriet to go over some of the feedback we've had from our members.
Brilliant. Thank you so much, Tamsin. I really love those quotes. So in our most recent user survey, 92% of members said they found the forum helpful. Most members said that the community had helped them to feel less isolated, and members said that talking to other people they could relate to helped them to feel reassured and less lonely. And 51% identified as a carer, and 45% as a relative, and 7% as someone living with dementia themselves. And you might notice that this adds up to more than 100%, and that's because members could choose more than one option, and some put themselves in both categories. So both a carer and a relative. So a bit about our volunteers and staff. So all of our volunteers were originally members of the community, and they either care for someone currently with dementia or they have been carers in the past. And at the moment, we have 5 members of staff, including me and Tamsin, and including 2 working at the weekends as well. So volunteers are supported all week, and 11 of our amazing volunteers are spread all over the country. So a quote from our volunteer moderator, Izzy. She said, "Being a volunteer has given me a lasting focus. I don't want to lose my connection with dementia, even though my husband died almost 8 years ago. Being a volunteer has allowed me, in a small way, to support others and use the skills I developed through caring. I never cease to be amazed by the peer support and understanding that members show to each other." And a quote from our manager, he said, "The forum is a caring and supportive online community for people to get support, advice and guidance from others with lived experience. Whether someone has a question, needs to vent, or just wants to read more information about dementia, our community is available 24/7 and our staff, volunteers and members are ready to support." So I'll just talk you through a bit about what we do as a staff team. So we handle all emails. We identify and support people who might be vulnerable or at risk of harm or abuse. We moderate, delete inappropriate content, diffuse conflicts or close unhelpful discussions. And thankfully, this doesn't happen too often, but sometimes it does, so we need to be ready to step in. We also support members who have technical issues as well, or maybe they've joined and they aren't sure where to start or how to post. We create discussions in order to empower our members to share their own experiences, amplify their needs and voices, and give the community as a whole a collective voice to influence others. We also support campaigns and fundraising efforts, and we help with evidence to show that the forum helps and how it helps people and the difference that it makes. So this is an example of a recent thread. So a recent question, we asked people about any tips for having conversation around dying and end-of-life decisions. And obviously this is a really difficult and a really sensitive topic, and we weren't sure how many replies we were going to get to this. But we've actually, hopefully you'll be able to see, we've actually had 2 pages of responses from people, which is a lot of responses. So that was really good to see people talking about such a difficult topic, and they had really, really good tips and really good experiences to share as well. And that's it. Thank you so much, everyone. And if anyone, sorry.
Thank you, Harriet, and thank you, Tamsin. We're not able to do questions, Q&As during the webinar, but please, if you've got any questions, please pop them into the Q&A panel there. And as I said at the beginning, we will pick them up, and obviously then we can direct them to the appropriate services. And just to say, really, there isn't a question that's silly. Please, any question at all, pop into the Q&A, or alternatively, you can go directly to Alzheimer's Society. The details are there, or you can come to our email address and we can signpost you across. Lovely. Thank you ever so much. Next, we have Sarah Russell, who is from TIBS Dementia Foundation. Over to you, Sarah.
Hello, hi. It's lovely to be here with everybody this evening. So I'm Sarah Russell. I'm from the TIBS Dementia Foundation. So we are a local charity. We're based in Bedford, and we cover all of Bedfordshire, supporting people to continue to live as well and as fully as they can. So I'll tell you a little bit more about what we do. But first of all, just wanted to sort of just do a quick overview of how we see dementia and sort of dementia support, really. So as speakers will have already sort of said, you know, that dementia can affect all aspects of daily living, and it's not just about memory loss. So dementia can affect the way we see and interpret the world, sensory changes, it can affect the ability to process sound, it can even affect how we smell, how we taste food, and changes to sensitivity and touch. So it really can impact a lot on our everyday lives. It can affect the way we communicate, And it can cause physical changes as well in our mobility, our balance, and in our fine motor skills. So it's really can be quite sort of life-changing. And also, people often ask me about the sort of different stages of dementia. You know, what stage do you think my relative might be at? And you know, that can be quite difficult for people. Also, when people talk about, you know, the worries about perhaps developing dementia, am I developing dementia, or is it just related to the fact that I'm getting a bit older? So as we age, all of us develop age-related memory loss. As we slow down physically, our brains also slow down as well cognitively. So there's the age-related memory loss. And then there's something that perhaps goes a little bit beyond that, which we might call a mild cognitive impairment. Still got that ability to live well, to live independently. It's just taking that little bit of extra time. It's just causing us perhaps to feel a little bit anxious. We perhaps can't multitask as well as we used to. So that may be considered a mild cognitive impairment, which may or may not go on to develop into a dementia. It could be one of many reasons, many causes that are affecting a mild cognitive impairment. And then really we start to think about having that diagnosis of dementia and then living through the early or the mild stages, or the mid to moderate stages, and then later on we'd be moving into the later, or what might be called the severe stages. So at TIBS, we like to think about the different stages really as what we can do to support people to live well. And so in the early stages of dementia, what we're thinking about is helping a person to retain their independence. So it can be very easy as a carer, with the best will in the world, when your loved one has received a diagnosis and you're not sure of the symptoms, you're not sure of the trajectory of the disease, the person's displaying some symptoms, that it's very easy to sort of take over, to assume that because you can't do one aspect of daily living, that perhaps you can't do any aspect of daily living, that because perhaps you're not so safe now to do some tasks, that perhaps that means that you're not safe to do any tasks. And so people can quickly have that independence taken away from them and can quickly become dependent on other people. They can lose their confidence, they can lose the skill sets that they have. It's that sort of use it or lose it. As Wendy Mitchell has written some books about her experience with dementia, very interesting books to read. Wendy Mitchell, she's in all good bookshops. She was diagnosed with dementia, young onset dementia, when she was, I think, 56. And in one of her books, she talks about when she was diagnosed, and her daughters were very concerned and they wanted to support her as fully as they could. And so when they were going out, they were helping her to put on her coat and do her buttons up. And she turned around and said, look, if you do this for me, I will lose the skill. I won't be able to do this anymore. And anytime I want to go out, I'm going to have to call you and you'll have to come round and help me to put on my coat. She said they quickly learned that what they needed to do was to see what she could still do and help her to retain that independence. And then as the disease progresses, then you might need extra help. You might need somebody to support your the safety of that individual. And then later on, we're thinking more about the comfort of that person. But we're still throughout trying to help that person to retain their independence. So even if they're in the kitchen making a cup of tea, they can still be in the kitchen. It might be that it's just not safe perhaps for them to lift the kettle, but they can still perhaps find the mug. They can still perhaps put a tea bag in the cup. They can still put some sugar in the cup. So we're looking at helping that person to retain what function they can, but also in that safe environment, and then thinking about comfort. And that's a very, very fine balance to make. And things can fluctuate on a day-to-day basis, but it's just bearing that in mind all the time. So at TIBS, what are we measuring? So we like to think that we're measuring the things that people can still do. We're trying to take that sort of positive ethos that a person, we're looking beyond the dementia. We're acknowledging that people are perhaps struggling. There are challenges in day-to-day living. There are certain tasks that people will find difficult, but there's still a lot that people can do. And there's a lot that people can do with the right support, the right encouragement, and the right help to be able to do it. And that's the things that we're focusing on at TIBS Dementia. And that's what we're encouraging family carers to do as well. Support the person to continue doing the things that they can still do and the things that they enjoy doing as well. So not all brain functions are lost. Again, if you want to Google somebody, I'd say Google Teepa Snow. She's a brilliant American occupational therapist, and she really understands dementia. She's got lots of very short video clips on YouTube. And if you just did a short YouTube Teepa Snow dementia, then you can see lots of little short videos about her thinking about dementia and that sort of positive approach. So yeah, I think you have to keep clicking now to get the little things up. That's it. Brilliant. Thank you. So, oops, sorry. That's always a tricky slide, that one. So with Teepa Snow, we're talking about a sort of rehabilitative approach. Now, we're not saying that we're going to cure people. We're not going to make people better. But when we're thinking about rehabilitation, we're thinking about people maintaining their function. We're thinking about what are the things that we can do so that people can stay as well and as busy and as active as they possibly can, retaining function, maintaining that function for as long as we possibly can. So Teepa Snow is sort of talks about what are the things that are lost. Some of these things are situated sort of in the left brain, as we might call it. These are the things, the areas that may be affected quite considerably in dementia. So things like our vocabulary, our comprehension, our speech production, perhaps our sense of logic. But she argues that actually the right side of the brain is retained. And if we can focus on that, then, you know, we're doing really well. So that social chit chat, that can be retained. Rhythm is really fantastic. And right until the end stages, people will really respond to rhythm. Music, prayer, poetry, again, those are all rhythmical things. And we've got a lot that we can do if we're thinking about creativity and how we can get people to connect in different ways. So verbal communication may have been lost, but people may be able to get up and dance, people may be able to clap, people may be able to sing, and that can be a really wonderful way to retain that connection and to find those moments of joy and happiness, and as I say, connection with other people. Also, people may lose their inhibitions, that filter may be reduced, and so swearing and bad language. Now, you know, that can be a means of communication. It might not be what would be ideal, but, you know, it can be a means of communication. And I know it can be really difficult for people, a loved one who you've never heard swear before. It can be really difficult, but you know, it's trying to reframe that as, okay, this is what's left now. Let's use that as a sort of a tool for communication and connection. Okay, let's move on. So when we're thinking about the focus on the left brain and the losses, then we might think about memory. There's a loss of words perhaps, which could lead to greater confusion, which is going to lead to a loss of confidence, which will in turn lead to a sense of withdrawal, to further confusion. So we've got that loss, that use it or lose it. If a person's feeling more confused, more anxious, then they're going to isolate, they're going to withdraw. And we know from when Diane was talking that it's so important that we retain our social connections, because otherwise we just retreat, we just withdraw, the apathy sets in, depression, and none of that is going to be helpful for us living with dementia and memory loss. But if we focus on that right brain of what is retained, what we can still do, and we think about that creativity, we might think about rhythm, we might think about that music, that might help us then to connect with ourselves and with other people. You hear that piece of music that you haven't heard from when you were a child, and there's an immediate connection. You go right back, that nursery rhyme. that sense of feeling loved, of feeling safe, being with your mother, having that sense of purpose, being loved. And that can help you reconnect with yourself, and that can help you reconnect with others as well. And that's going to lead to increased confidence. Sorry, just go back for a sec. To increase confidence, that can lead to greater sense of belonging and status, to further connections, to more creativity, to a greater connection with others. So you can see that that confidence is building, and you can see that that person is being built up, and you know, that those connections and those abilities and you know, are just being restored, really. So that's what we're talking about when we think about rehabilitation in dementia, and really that's what our services and our activities are focused on. So what we're all about is really helping people to retain their brain function, their physical well-being, and their social connections. And we're trying to help people to continue to live as well as they possibly can. And we do that through different ways. So we have information, because information is key. Having that knowledge, having that information about, well, what is going on? What is dementia? What's going on in the brain? You know, what are some of these symptoms and how can I manage them? Also information about the services, the support networks that are out there to help you to continue living well. We focus a lot on cognitively stimulating activities, CST as we sometimes call it. So that's keeping that brain active. You know, as I said, you know, the brain is a bit like a muscle. We want to be exercising it as much as we can. We're thinking, as Diane said, about our well-being, taking that holistic approach. So encouraging people to eat well, thinking about sleep, thinking about relaxation. We have some online yoga classes and relaxation sessions. Also thinking about physical activities and the fun that we can have through physical activities. We've got an allotment because being outdoors and that green environment is so important and so valuable for all of us, and especially for people with dementia as well, who can have that real connection with nature and a real love with nature. Creative activities, social activities, which are key and so important. And then really important, carer support, opportunities for those with caring responsibilities to meet other people, to share experiences, to share information, and just to have that immediate empathy and rapport. And then also bereavement support as well. So here's just a few sort of pictures, really. So the power of art. So we run creative art classes. This is Phil. He's a person who developed dementia, and then he developed a love of art. And it was a real lifesaver for him, especially through COVID, when he could really connect through his artwork and find a really powerful means of expression. And his artwork has been displayed in galleries. We've displayed his work in London. I'm looking at two pictures at the moment on my wall in front of me. Really joyful work, and you know, a great way to connect and to use you know, that sort of connection. Okay, so we can move on then. So the power of practice, as I say, with the CST sessions that we run and the activity groups, it's all about practicing. It's all about keeping that brain working, that sort of neuroplasticity of the brain. The more connected we are, the more we're using the brain, the more those neurons are going to fire up, and the more that we're going to feel invigorated and be using those brains positively. And the power of music, so important. And we offer music for memory, as we call it, across Bedfordshire. And music's incorporated into all of the sessions that we do. And it can bring an immediate sense of joy, of happiness, of energy, of connection. And it's a wonderful thing. And we enjoy performance as well. Just because you have dementia doesn't mean that you can't stop performing. You can't take creative risk. You can't get out there and keep showing people the talents and the skills that you have, and just enjoy being in that moment on the stage and taking that bow and loving it. And the power of sports so important. It can just give us that connection with other people. You're part of a team. You don't have to be talking. You're connecting through the way that you're playing. And if you score that goal, even if it's an own goal, you've just got that sense of achievement. Sport is such an important thing for all of us, as well as that physicality, just the emotional drive that it can bring. So we do walking football, we do indoor bowls, we've got walking groups, we do exercise classes with the University of Bedfordshire, we do dancing as much as we can, and we're just forever looking at new opportunities and ways of keeping fit and enjoying doing sport together. And the power of the outdoors. I mentioned our allotment. We love going down onto the allotments, maybe not quite so much now, but we're just shutting up for the winter. But just being there, watching plants growing, and then being able to take home the produce and thinking, I've grown this, that sense of achievement, and again, of working together and doing something physical together as well is really valuable for people. And the power of learning, as I mentioned before, that information and knowledge is key for understanding our dementia symptoms and building strategies to manage these. So, you know, we're always encouraging people to learn, to join one of our support for memory sessions, or to sign up for our newsletter that comes out every week, where we just try and keep giving people that bit of information. And the power of laughter, most importantly. If we take anything away from today, it's that what we all want to do is to connect, is to make social connections with other people, to laugh, to have fun together, to put our problems to one side, and for half an hour just to be with other people and just to enjoy being together. And this was us in Bedford Park. We were doing some line dancing, and somebody said, it's not how good you are, but it's how good you feel. And that really sums up Tibbs Dementia Foundation, is that we're all there together. We're a supportive community. We're there to try and help each other, to support each other, and for all of us, whether we have dementia or not, to live the best lives we can every day. So it's not about how good you are, but it's about how good you feel. This is just our timetable, our Central Bedfordshire timetable. This is just a sort of overview, just so you can see the sorts of things that we do. In green are the sort of activity groups that we do. In pink are our music for memory groups. And then the other support groups are in blue, and our physical activity groups are in that sort of yellow orangey colour. But if you want any more information, then please do get in touch. I think the next slide shows our contact details. So get in touch, send us an email, check out our website, or give us a call, and we'd love to have a chat with you. Thank you.
Lovely. Thank you, Sarah, for a very joyous and heartwarming presentation. Thank you.
Thank you.
Lovely. And next we have Age UK. We have Hilary Tohi presenting. She's going to explain all the services available from Age UK, and also a little bit about benefits and allowances.
Thank you. As I say, thank you for the introduction. So if you could go on to the next slide. Thank you. So Age UK Bedfordshire is the largest charity supporting older people in Bedfordshire. And we can help anyone over the age of 50 who resides in the county. But we can also help and support families, carers and friends of that person. So, you know, we can help all round, really, family and that person. So thank you. This just lists some of our services. So we have an information and advice service, and then our other services are there to support people in the home. Really, I think our ethos is to help people remain as independent as possible for as long as possible. So lots of our services are very practical, and I think that's essential for many people as they're living alone or managing to live as best they can at home. So, so thank you. If we could go on. So our first, the big service we offer is information and advice, and this is completely free to the user. And for many people, the first time they might contact us is through a change of circumstance. So it could be a diagnosis of something, a change of health, hospital, been in hospital for a while, or just generally finding life more difficult to manage. And that's often when people might come to us. So our information and advice service there is to help with any issue that might concern our clients. And we have a really wonderful team of highly skilled volunteer advisors who, because of what they do, they are very knowledgeable and they can help with most things that people come to us with. But if we aren't able to help, we're very happy to signpost to the most appropriate organisation, and we work with so many of the other organisations in the county. And I think you've just said those words, no question is a silly question, which is what I think our team would say. So we would always try to make sure we find the answer. We will take self-referrals. So sometimes people come to us for themselves, or family or friends might contact us about a relative, or professionals. So that could be social workers, GPs, whatever. Someone, if they're concerned about a person, they will come to us. So if we can go on, thank you. So as I say, it is a free service and it covers a variety of topics. So probably one of the most important is benefits and financial support. And that is often what people are looking for or unaware of what is out there. Otherwise, it's such things as housing, social care, or just local services and support. So we can try and make sure we have the answers for whatever anyone asks us. So if we can move on. Through Age UK, the national charity, we can offer a benefit check. It's completely confidential, and it enables the client to know what benefits and allowances they're entitled to. So many people, and I think most of us, might not be aware of what's out there until we need it. And it's really good to know through the benefit check what someone can claim. Age UK, in a lot of their booklets, talk about the amount of money that goes unclaimed by people in later life. And it's often because people either are nervous of asking or they just don't feel they're entitled to something. But our benefit check will help someone to know what they're entitled to. So the most common benefit that we help with is attendance allowance. Attendance allowance is a non-means tested benefit, and it is there to support someone who needs help, some assistance to live, to manage living, at home, or just needing help in whatever way. So it could be there's a higher and a lower rate. The lower rate is if you just perhaps need help during the daytime. Higher rate is if you need help both day and night. As I say, it's non-means tested, and there's no checking on what it's been spent on. That money goes into the client's bank, or the person's bank account, and they can use it for whatever makes their lives easier. So it could be anything, could just be using taxis because they can't drive anymore. So it's a really good benefit. So it's well worth looking at attendance allowance. There is a carer's allowance for someone who's in the caring role. That is means tested. So that's why our benefit check is really good at letting someone know what they can claim and the impact it might have if they're already claiming other benefits. So quite often they overlap and they might change things. Pension credit is obviously in the news greatly at the moment, and that is one that if someone is entitled to it, even if it's a very small amount, it opens the door to lots of other benefits. So including winter fuel payment, which is the one that's obviously this year is in the news, but it also council tax support. There are all sorts of things it might open the door for. So it's really looking at all those things, and we are able to help with that. We also can help with Blue Badge. So if someone has had a diagnosis of dementia, you're now entitled to have a Blue Badge. It is another form to fill in, and as I've got on there, we're more than happy to help with complete the complex forms. Because our team of advisors do fill out the forms all the time, they're very good at answering the questions accurately and knowing how to make sure someone if they're entitled to that benefit, they will get it. People sometimes come to us with a half filled out form or a form that's been rejected, and then we try and help make sure that they do get the benefit they're entitled to. So we go right through that process with them, and we always make sure we check up to see whether someone's actually managed to get the benefit that we're helping them with. So we will go right through them with that service. Just quickly to say, we have a solicitor who supports us by giving 15 minutes free advice, either on the phone or face-to-face in our office in Bedford, and that is just to help with any aspect someone has an issue with that might have a legal side to it. Our team of advisors are very knowledgeable, but they're not legally trained. So the solicitor is who we would offer support to someone. So it could be power of attorney, wills, care costs, anything that has a legal aspect. So, and 15 minutes may not seem long, but it really is helpful to someone. Next slide. We have a community support worker who visits clients at home and supports them with more long-term complex cases. So it's really if someone's finding life quite difficult to manage, and it could be all sorts of issues that have changed life for them, she will be there to support. So it's a really good service, and she just assists people longer term. So we can be contacted by telephone, email, or through our website, and we offer appointments at our office in Bedford, but we're also very happy to come out to visit people at home, so to make sure that everyone in Bedfordshire can get our support. Then we've got our home support services, which are there also, thank you. They are there to help people manage at home, which is what I said earlier, is helping people to remain independent. So we have a home help service, gardening, handy person service, a carer's respite service, and a telephone friendship service. So I can just tell you a little about them. So we go on to the next slide, thank you. So our home support service is there to support people in their own homes, and we've got a fantastic team of staff. So we employ our staff, so they're interviewed, referenced, they have an enhanced DBS, which is the criminal disclosure and barring service record. They come in uniform with photographic ID. They all work in an area, so they're not asked to travel all over the county, and all our staff are given a rota of people they see, so they really do get to know their clients, which makes such a difference. And they are there to offer anything to do with the home. So it could be just changing the bed, putting the washing on, doing all the washing and ironing, shopping, cleaning. They will have a cup of coffee with their clients, catch up with them each week. So it's a really good support service that makes sure that they're looking after their clients in every way. So if we can move on, thank you. Our gardening service is in the same vein, and I think for us, we realised that for many people, they can manage indoors, but actually if they do have their own garden, sometimes the garden is the thing they struggle with first. So we've put a gardening service in place, and it's extremely popular. It's really busy throughout the summer particularly, but all year. So as I say, we employ our gardeners in the same way as we do our home support workers. They have all the full checks. They come again in uniform, but they bring their own electrical equipment, because we have to be careful of not using equipment that's perhaps been in a shed for years or whatever. So it's regular maintenance, so it can be year round or it can be suspended through winter. So it's a really lovely service. Again, our gardeners get to know their clients, and we are very much there to support many people with dementia. It could be a couple or a person living independently. So, and our staff are trained to help to understand how to support people best. And we always do assessments to make sure our services are there the right service for a person, and we will always have a next of kin that we can contact if our staff are concerned about their clients. So if we can move on. So our handy person service, this is much more of a one-off service, but it's amazingly busy because so many people are looking for someone to do smaller jobs in the home. So again, we employ our handy people, and they come with the same uniform, photographic ID. It's basic DIY, including home security. So we'd always assess to make sure it's a job we can do. But it's lots of things to make the house safer. So grab rails, key safes, stair rails, just general aids for health and safety. So, but we'll do flat pack furniture, put up curtain rails, any jobs really that perhaps someone used to do but can't do anymore. So so that's really another really excellent service. I should have said with our home help and gardening service, the member of staff comes at the same time each week or fortnight, so it makes it really helpful for the client to know that person when they're coming, and they know to expect them. So it's a really, really helpful. Handy person service, as I say, is more of a one-off service. So if we can move on. Through the contact we have with so many of our clients, we've become very aware that for many people, they are in a caring role. They might be caring for someone, their loved one, either at home or just generally being there for that person. So we put in, with support of local authorities, we put in a carers respite service. So it's there to support someone. The person needs to be over the age of 50 because that's who we support, but caring for someone over the age of 18. So we aren't able to help someone care for a child. But so our staff come out, they're trained, have all the same checks for when we employ them, and they're there to offer. It could be a one-off service for someone who just needs some help just to be with someone while they're out. But generally, we feel it's more beneficial if it's there as a regular service. And many of our clients really do find that helpful, having someone in on a weekly basis and knowing that the person in the caring role can go out, go shopping, go and get their hair done, go out and do some gardening, or just generally be around and have a little bit of time. I've put there that financial support is available, and that comes through the local authorities, through Bedford Borough Council and Central Bedfordshire Council. They offer a carers assessment. It's non-means tested. It's purely to look at the person as the carer. And then they offer financial support with various different services that help support that person in their caring role. And the things that we can offer through that is our home help, gardening, and the respite service. So in Central Bedfordshire Council, they give vouchers. So one voucher would cover 1 hour of our home help or our gardening or our carers respite service. So it's something to think about if you are in the caring role. As I say, it's non-means tested as an assessment, and it really does support people if they are a carer. So it's something to look at. So if you would like help with that, please do contact us. So thank you. If we can move on. Just to give an idea of the things that we can do. So really it is just things, if somebody would like to go for a walk each week, we would do that. We can help them eat if that's what they would like, a snack while their care is out. Play games, board games, watch TV, listen to music. Generally provide companionship and conversation, or just simply be there with them, just so that they know they've got someone with them. And I have just put there that we aren't able to offer personal care. We're not insured to do that. So that is something we would always discuss before we set up the service. So, but it's alongside our other services, the respite service makes such a difference. So thank you. If we can move on. Our telephone friendship service. We're very aware that all our services are there, and we are a friend going in with all our staff who go in and visit their clients on a weekly and fortnightly basis. But we're also very aware that for many people, they may be living alone or feel quite isolated, or perhaps don't have many people that come in to see them. So we've set up through support through the Harper Trust in Bedford and in Central Bedfordshire Council, we've set up a telephone friendship service. It is a lovely service to just give people that bit of extra support and friendship. So we've got a member of staff who runs the service, but we've got a fantastic team of volunteers who are there to phone people on an agreed day and time. So we'll always have an assessment with that person, check that it's a service they would like, and then we set it up. And then each week or fortnight, someone will call them could be a 5-minute chat, 40-minute chat, whatever that person would like. Just to say, we take referrals. We often do get referrals through different organisations, family, or it could be the person themselves. So I'm very happy to set that up for them. So as I've just said, our team leader makes the first call to establish the link with the new client. So we just get to know them a little bit, understand, where they live, their interests, what they did as a job, all sorts of things about their family, anything they would like to talk about. So that when we have conversations, we do have some idea of that person and what they'd like to talk about. If we're concerned about someone, we would always try and signpost them to help, and let them know that we would look for more help for them if they need it. And we'd always treat everyone with the greatest respect. All our staff do, and really value our clients. And in all our services, we're always a friendly ear. So thank you. So just really to finish off, we feel the added benefits of our services to our clients are our services that we offer regularly, a regular contact with someone, through our information and advice and all our other services. We help them to make a choice to remain in their own home. So it might be that we've managed to get them attendance allowance, which helps them to pay for services in the home. Anything really that we've done, hopefully that it just helps them to make the good choices that are the best for them. With friendly and high quality help, and social inclusion is that contact with us generally. We're constantly on to phone to clients, and obviously they have face-to-face with our staff. And the honesty and reliability of all our services. We are there to support all our clients in everything that we do, and we will always look for help if we feel that they're struggling or any other issues they're dealing with. So thank you. I've given a really whistle-stop tour of our services, but thank you. And obviously I know I've left that slide on about questions, but if you have got any questions, obviously they will be forwarded to us, and very happy to answer any questions and help anyone we can. So thank you very much.
Thank you, Hilary. It's such a full service and it's hard to squash in 15 minutes. I really appreciate that. And next we've got carers in Bedfordshire, again talking about their services, but also including the Herbert Protocol and the Memory Navigation Service. And we've got Martin McGlynn.
Yes, thank you. So yeah, hi, I'm Martin, and yeah, I'll be talking about carers in Bedfordshire, the Memory Navigation Service, and a bit about our Herbert Protocol. So we're an experienced charity, and we've been supporting unpaid carers of all ages across Bedfordshire. For 20 years, carers in Bedfordshire have been improving the health of well-being of carers and the people they care for, improved confidence and trust in carers, and this has reduced hospital visits. This is because as well, a lot of personal stress and personal things can result in a lot of ill-being. What we do at Carers in Bedfordshire, we support carers of all ages over the phone through face-to-face contact support groups, workshops and more. We've got dedicated services for adult carers, young carers and dementia support. Next slide, please. Who is a carer? Who is a carer? Anyone who cares for an unpaid relative or friend, someone who couldn't manage without them because of a disability, illness, long-term condition, or addiction. This can include practical support, such as cooking, tidying, cleaning, and so forth. Also personal support, such as washing, changing clothes, giving medication, and it can also be emotional support. A lot of people may actually be a carer and they may not even realise. So if you're not sure, don't let that be a barrier in talking to us. Next slide, please. So caring can be so many different things. Some of these are some things that we've heard from people from their experiences of what caring can be. It's very subjective to them, and every time that someone goes through it, they may go through another sort of experience around it. Next slide, please. So how we help. We help people in so many ways that we can. We have one-to-one support, which is a large base of our support. We do telephone support, and we kind of go for a holistic sort of view where we offer support in a roundabout way, where we look at different areas of someone's life, and then we can kind of look in to see what kind of things that we can help out with that. We also offer financial grants for well-being. So this is money that we can give if it's there to help someone's well-being. This could be something, this could be like a little breakaway, this could be taxis, this could be having sort of a cleaner. So it's something there that we can offer. We have a benefits and welfare advisor. We have a hospital support hub. We have social hubs. We have training sessions. We have online resources. We have telephone befrienders. And we also have wellbeing support. We have a wellbeing practitioner who does one-on-one wellbeing support, where they can talk about things individual to them. Next slide, please. So to register with us, you can give us a call. You can send us an email, or you can go onto our website, carersandbeds.org.uk, where we have a registration form. If you do not feel comfortable using the online form, you're more than happy to give us a call, and we'll be able to do that for you. Next slide, please. So next, I'm going to talk to you about the Memory Navigation Service, and this is a service by Carers in Bedfordshire. So we also offer support for people caring for those living with dementia and to those living with it too. Next slide, please. So how we can help. Our trained volunteers keep in touch with people to offer check-ins to see how things are going. So every now and then, our volunteers will give a call just to check in, see how you're doing, have a chat. Sometimes some issues may come up at the time. Sometimes they might happy for just a little bit of a chat. Our dementia support workers and volunteers can help you access dementia support. We have a dementia nurse who can answer questions about medication, medical issues, or something that's a bit more of a clinical insight. We also run dementia-focused groups and events across Bedfordshire. And we also have our dementia handbook, which is full of useful information, and it's there access online, or we also have physical versions as well. Next slide, please. So when we receive a referral, you'll receive a phone call from someone in the team, and we will discuss your circumstances and identify where you need support. If help is needed at the moment, you'll be allocated to a dementia support worker where we'll support as necessary. This could also be another specialist at Carers in Bedfordshire if needed. For example, it could be referred on to our wellbeing, or it could be to our welfare and benefits advisor. You'll also receive 4 welcome emails to understand what we do and not be too overwhelmed at once, as there is a lot of information from that we do, so we don't want to overload you. And we also will have invitations to events that we put on that might be specifically near to you. So you're encouraged to contact us if you need any further ongoing support as time goes on. You never know when you will need support. So the diagnosis pathway. We can support you at any point along your journey. This can be from when you notice initial symptoms. This can be from your initial chat with your GP, and then when you have a diagnosis. And then even if you don't get a diagnosis, you'll be more than welcome to give us a call and have a chat. Anytime going forwards, you never know when you'll need extra support. So there could be times where maybe at first you have everything in place, and then suddenly something new comes up, and it's good to be sort of registered with us, give us a call, and then we can kind of offer you support ongoing. Next slide, please. So there are a lot of other places that we may refer you to. A lot of them have been talking about today. So you've got Age UK, the local authority, Tibbs Dementia, Beds Rural Communities Charity, the Beds Fire and Rescue Service, different government services, and also Bedfordshire Police. Bedfordshire Police have something called the Herbert Protocol. So the Herbert Protocol is a national scheme designed to help people living with dementia or memory problems who go missing and to locate them quickly if they do. Sometimes people with dementia may go for a walk, they may go into the garden, they may go into the street, but they also may go further away. So the Herbert Protocol, you can fill out a form beforehand giving information about characteristics, physical description, places that may be of interest. This could be a previous workplace, previous homes in their life. And so we can include it all on this form, which we can give to Bedfordshire Police, and also keep one for yourself. We then, if by chance someone goes missing, we'll then be able to have a look at this information, and then Bedfordshire Police will be able to locate them earlier on. So this is a wristband, which can also is a new sort of smart devices which are used for people living with dementia. So these can be used as a pendant or a wristband, and they will have a code on them, and you can scan them, and this can bring up vital information which someone can locate their telephone number or home address or certain things like that. Next slide, please. So to register with the Memory Navigation Service, the quickest way, again, would be to go on our website, memoryinbeds.org.uk, and there you can register for support there. You can also give us a call on 0300 11 90 90, and you can have a look at our website, and our email address is info@memoryinbeds.org.uk. Thank you.
Lovely. Thank you ever so much. Again, a lot of information to squash into sort of 10-15 minutes. I really appreciate that. And last but not least, we've got Kaylee Charlton, and she is from Headway.
Yes. So I am from Headway. I'm just going to talk just very briefly about memory rehabilitation and the services that Headway Bedford provides for people. So as you can see on the screen, there are 3 types of memory. These are our immediate memory, our short-term memory, and our long-term memory. So your immediate memory, which is also referred to as your working memory, is where the information you are trying to remember is sent and is only held onto for a very short space of time, often just seconds whilst it is being used. For example, holding a telephone number in your head whilst you write it down. From here, it is sent to your short-term memory, where the information is stored for a short period. This is like roughly a couple of days before it is either rejected and erased or consolidated into long-term memory. And when I say memories are rejected, this is because our brain cannot store every single memory. It's not built to do that. And that means things that are not important or needed to be remembered after a few days will be rejected. So, for example, a conversation during a meeting when you were asked to complete a task, once you've completed that task, that memory then goes because you don't need it anymore. And then finally, your long-term memory is a bit like a library archive, and it's when information is sent if it is relatively safe. So your long-term memories can be stored for several years, sometimes even your whole life. Your brain consolidates memories into your long-term memory in the hippocampus through rehearsal and connections to existing memories. And this is why individuals who have weaknesses in short-term and working memory, so for example, those with brain injury, those with dementia, often have difficulty learning and applying new information. Next slide, please. So some examples of memory impairments include forgetting what has been said, difficulty learning new skills, repeating information and questions over and over again, or telling the same stories and jokes over and over again, or things like finding like television programs difficult to follow, books difficult to follow. They might forget people's names, get details mixed up, forget changes in routine, forget where things have been placed, all sorts of ways it can present itself. So other factors influencing memory, so attention is one of them. So it's probably the biggest factor to influence memory. So without attention, a person cannot have explicit memory, which is conscious recollection of events. So for example, like remembering your phone number or identifying who the current Prime Minister is, remembering what time you're meeting a friend later on, etc. So fatigue, factors that influence attention, such as fatigue, exert a subsequent influence then on memory. Poor sleep can negatively impact on memory, as was discussed earlier. We know that sleep is important in consolidating memories. So if sleep is disrupted, you may remember things from the previous day less well than if you've had a good night's sleep. So that's why, again, as discussed earlier, it's so important to have a good sleep routine. So going to bed and getting up at similar times every night, avoid caffeine later in the afternoons, keep your bedroom dark and cool, so on. This is especially important if you need to take on a lot of new information. So for example, if you're trying to learn a new skill. Mood. So mood can have a negative influence on memory. If you're feeling anxious and low in mood, and especially if you have a lot of worries or tend to ruminate about things that are now difficult in life, this can consume attentional capacity and leave fewer resources. Low mood can also result in biased thinking. So you're more likely to recall negative memories when feeling low and find it harder to access more positive memories. Some medications can also have an impact on memory and on attention with subsequent effects, as we've discussed, and just generally aging. So aging has a specific impact on memory over and above the general effects of cognition. So just some of the memory strategies that we would try and teach at the centre at Headway Bedford. Obviously, we know that memory impairment following any brain condition, injury or dementia can negatively impact daily living and quality of life, but these effects can be reduced by memory rehabilitation. So some of the approaches to memory rehabilitation include things like internal strategies, so making use of the memory that we currently have, so a bit like the brain training that was discussed earlier as well, exploring ways to expand on current skills. And we also teach things like external strategies. So that includes devices or items that are just physically holding the information that you need to remember. So instead of relying on your brain, you can look at the prompts on your phone or on your calendar. And we also try to teach combining strategies as well, because we find this to be the most effective way. So some strategies include elements of both types, and they can be personalized to your abilities as well. So the holistic approach in which social, emotional, and behavioral deficits are addressed alongside cognitive consequences of the brain condition. And it may also be that some of the other effects of your brain conditions, such as fatigue or problems with concentration, interfere with the ability to focus on information, to learn it in the first place. So addressing these problems may then in turn help to improve your memory, just as like a side effect. So the Headway Bedford services then, so we were originally founded in 1984 as a brain injury support group, and we set up our first service centre and base in 1990. So we provide a holistic, client-centred approach to the consequences of brain injury through cognitive, physical, social and emotional relearning and rehab services. So today we have a dedicated premises at the Bedford Health Village, which is conveniently located near the Bedford Town Centre. Most of our client referrals come from the NHS, GPs and other social services professionals, but we do also welcome direct approaches from anyone affected by brain injury throughout the Bedfordshire area. And our mission statement is to improve the lives of people who have acquired a brain injury by providing excellent services which promote independence and well-being through enabling our clients to establish and achieve their personal aims and objectives. So we offer group cognitive sessions, and that includes brain injury education. We teach you to relearn skills, learn coping strategies, particularly with things like memory difficulties and photography. We have physiotherapy service that's one-to-one sessions, group exercise sessions. We have free use of the gym. We have speech and language therapy, again, one-to-one sessions, communication groups, and we offer music therapy groups as well. As stated earlier, music and speech are some of the things affected by dementia. So music therapy can be a really great way to help rehab with that. And then occupational therapy, so one-to-one sessions, fatigue management courses, pre-vocational courses. And we also support with other things as well. So after a brain injury, individuals often experience various emotional changes. These can be challenging to observe compared to more visible physical issues. So some of the common effects include personality changes. So families may feel as if the person they once knew has somehow changed. This is not specific to brain injury. This can also be with dementia as well. So for the individual with the brain condition, losing a sense of their own identity can be traumatic, and the healing process resembles grief, denial, anger, acceptance, and resolution. So it's essential to recognise that this process can take years and may not follow a specific order. We deal with mood swings or emotional lability. So brain conditions can lead to rapidly changing moods. So for instance, someone might be happy and joking 1 minute and then tearful the next. And emotional states may become more extreme, which means that distress can be caused over what seems to be minor issues. And the person can have inappropriate emotional responses, such as laughing at bad news, for example. Anxiety is something we see quite a lot. It's another common emotional effect. The uncertainty and changes in life circumstances can lead to heightened anxiety levels and just frustration and anger. So brain injury survivors and people with dementia may experience frustration due to cognitive challenges or physical limitations. Anger can arise from the struggle to adapt to these changes. So we see that a lot. And mental health conditions such as depression and sense of loss, like damage to the brain's emotional control regions, can cause depression. Additionally, gaining insight into the effects of the condition may contribute to feelings of loss. So coping with these emotions can be challenging for both the individual and their family. And then post-traumatic stress disorder as well. Some individuals develop PTSD after a brain injury. Flashbacks, nightmares, and anxiety related to the injury can significantly impact their emotional well-being. So sensitivity and understanding are crucial when dealing with extreme behavioural changes after a brain injury. And it's essential to recognise the hidden disabilities such as cognitive or personality changes that may not be immediately visible to others. So obviously, if you have specific questions, you can contact us. That's me.
Thank you, Kaylee. Well, we've come to an end of our specialist presentations, and absolutely spot on time, which I think is amazing. And we've crammed in lots and lots of information in 2 hours. So I'm really hoping there'll be lots there that are useful to all of you. We've put together a list of local dementia support and information groups and activities. There's a lot on one slide, so apologies. And it's not too clear, it's a bit blurry. So if you would like a copy of this slide sending to you or this information, just send us an email and we can send that through to you. Lovely. So just really some thank yous now. We're drawing to an end. Special thank you to all our guest speakers for sharing their information and all that knowledge, and to you all for attending. Lovely. 2 hours is a long time, so thank you for staying with us. A quick reminder, please, to fill in the questionnaire. Your feedback is really important to you. And I think we've also put into the Q&As the link if you can't connect via the QR code. If you have any further queries, you'd like support or signposting to any of the services we've spoken about today or any other services, or if you'd like help arranging a memory assessment appointment at your GP surgery, please email us and our care coordinators will be in touch. And again, we'll just pop that email address into the Q&A for you again. But thank you. Thank you again. And if you can complete the feedback form, we'd really appreciate it. It helps us to shape these events going forwards. So we'll just stay on for a couple of minutes with the QR code, so you can complete those feedback forms. Thank you again, and we'll hopefully see you soon.